Zonisamide is a medication used alongside other drugs to prevent and manage seizures, a common symptom of epilepsy. It falls under the category of sulfonamide anticonvulsants and also acts as a carbonic anhydrase inhibitor. The exact mechanism of how zonisamide prevents seizures is not fully understood. The recommended dosage for zonisamide is usually once or twice a day, and it is best to take it at the same time each day. It is important to follow the dosage instructions provided by your healthcare professional. Before taking Zonisade 100 mg per 5 ml oral suspension anticonvulsant, sulfonamide derivatives, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth, usually 1 to 2 times a day, with or without food as directed by your doctor. To prevent kidney stones, drink plenty of liquids unless instructed otherwise. If you are using the capsule form, swallow the capsules whole. If you are using the liquid form, carefully measure the dose using a special measuring device/spoon and shake the bottle well before each dose. The dosage is based on your medical condition and response to treatment. Your doctor will start you on a low dose and slowly increase it. It may take several weeks or months to reach the best dose for you. Use this medication regularly to get the most benefit from it, and take it at the same times each day to keep a constant level in your body. Do not stop taking this medication without consulting your doctor, and let your doctor know if your condition does not improve or worsens. Some common side effects of this medication include dizziness, drowsiness, trouble sleeping, lack of coordination, lightheadedness, loss of appetite, diarrhea, or double vision. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to note that this medication has been prescribed because your doctor has determined that the benefits outweigh the potential risks of side effects. Many individuals who use this medication do not experience serious side effects. However, it's crucial to contact your doctor immediately if you experience any of the following serious side effects: mental or mood problems, speech problems, decreased sweating, sudden back/side/abdominal pain, painful urination, or a sudden change in mood or behavior. In some cases, this medication may cause a serious metabolic problem known as metabolic acidosis. Seek medical help right away if you experience symptoms such as bone pain or breakage, rapid breathing, irregular heartbeat, sudden tiredness, or severe drowsiness. Additionally, it's important to seek immediate medical attention if you experience very serious side effects such as easy bruising or bleeding, eye pain or redness, vision changes, signs of kidney problems, or signs of liver problems. While it's rare, a serious allergic reaction to this drug is possible. Seek medical help immediately if you notice symptoms such as fever, swollen lymph nodes, rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. Before starting zonisamide, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to discuss your medical history, including liver or kidney disease, breathing problems, diarrhea, or any mental health issues, with your doctor before using this medication. Zonisamide may cause dizziness or drowsiness, so it's important to avoid alcohol and marijuana, as they can make these symptoms worse. It's also essential to avoid activities that could lead to overheating, such as exercising in hot weather. If you are an older adult, you may be more sensitive to the side effects of this medication, increasing the risk of falling. And if you are pregnant or planning to become pregnant, it's crucial to discuss the potential risks and benefits of using this medication with your doctor. Additionally, this medication can pass into breast milk, so it's important to consult your doctor before breastfeeding while using zonisamide. When taking Zonisade 100 mg per 5 ml oral suspension anticonvulsant, sulfonamide derivatives, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include carbonic anhydrase inhibitors, such as acetazolamide, and orlistat. Additionally, other medications can affect the removal of zonisamide from your body, which may impact how zonisamide works. Examples of these medications include other medications to treat seizures, such as phenobarbital, primidone, rifamycins, such as rifabutin and St. John's wort, among others. Your doctor may need to adjust your dose of Zonisamide if you are on these medications. It's also important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, including alcohol, marijuana, cannabis, antihistamines, such as cetirizine, diphenhydramine, drugs for sleep or anxiety, such as alprazolam, diazepam, sulpidem, muscle relaxants, and opioid pain relievers, such as codeine. Additionally, it's crucial to check the labels on all your medicines, such as allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Be sure to ask your pharmacist about using those products safely. If you or someone you know has taken too much Zonisade 100 mg per 5 ml oral suspension anticonvulsant, sulfonamide derivatives and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of overdose may include slow or shallow breathing, severe dizziness, and loss of consciousness. It's crucial to act quickly in these situations to ensure the person's safety. Always follow the recommended dosage to avoid the risk of overdose. It's important not to share this medication with others. While taking this medication, it's important to have regular lab and/or medical tests done, such as kidney function, bicarbonate level, and complete blood count. Make sure to keep all medical and lab appointments, and consult your doctor for more details. Remember to take each dose at the planned time. If you happen to miss a dose, take it as soon as you remember. However, if it's almost time for your next dose, it's best to skip the missed dose and continue with your regular schedule. It's important not to take a double dose to make up for the missed one. It's important to store Zonisade 100 mg per 5 ml oral suspension anticonvulsant, sulfonamide derivatives at room temperature, away from light and moisture. Be sure not to store it in the bathroom. For the liquid form, make sure to throw away any unused medication 30 days after opening the bottle. Keep all medications out of reach of children and pets. When it comes to getting rid of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.